Hello, my name is Alicia Delgado, and I'm a student nurse practitioner. This video will be an abdominal assessment. I've already let the patient know what I was going to do and got their permission to do this video. The first part of an abdominal assessment is inspection. When I'm looking at the abdomen, I'm noting the color, which is normal for the ethnicity. I'm feeling the temperature, which is warm to the touch. I'm assessing texture, which is nice and smooth. I'm also checking turgor, and the skin does not tent, so that means he's not dehydrated. I'm also looking for any edema, which I don't see. I'm looking for bruises, lesions, scars, striae, nodules. I don't see any of that present either. I'm also going to be looking to see if the abdomen is symmetric. I'm going to be looking for at the sides and as well by the feet. And I'm looking for any bumps or areas of the abdomen that might be protruding or sunken in, and I don't see that at all. The abdomen is round and symmetrical. The other thing you want to look for when you're inspecting the skin is the moisture. The skin is dry. Okay, for the next part of the abdominal assessment, I'm going to auscultate. Always want to listen before pushing in because you don't want to alter any of the bowel sounds. So I'm going to auscultate the arteries within the abdominal plain field, and I'm going to be listening for any bruits or hums. So I'm going to use the bell of my stethoscope, and I'm going to listen to the aorta, the renal arteries, here I'm listening for the iliac arteries, and then the femoral arteries, which I'm going to do over the clothing for this one. Okay, I don't hear any bruits or humps. So now I'm going to switch over my stethoscope, and I'm going to start with the right lower quadrant. And I'm already hearing bowel sounds, so I'm going to move up to the upper quadrant, and I'm going to work clockwise. The left upper quadrant, and then finally the left lower quadrant. So he has normal active bowel sounds. If I had heard hypoactive or no bowel sounds, then I would assess for 5 minutes in each quadrant. Okay, the next thing I'm going to do is I'm going to palpate. I'm going to do some light palpation. And I'm assessing for tenderness or any masses. Any tenderness?
None.
And there's no guarding, so now I'm going to do deeper palpation. And again, I'm assessing for masses. And I'm not feeling any. Okay, the next thing I'm going to do is I'm going to palpate the liver borders and estimate the span at the midclavicular line in centimeters. So midclavicular line, and I'm listening for dullness. And I'm also going to start from the bottom. And that's about 6 centimeters. Normal would be between 6 and 12 centimeters. Okay, the next thing I'm going to do is I'm going to palpate the right costal margin for the liver border. So what I'm going to do is I'm going to do use this specific method. I'm going to ask the patient, can you please breathe in and then exhale? And then I can feel the liver, As I'm exhaling, it descends, and it's firm but soft. I'm not feeling any masses or rough edges. It all feels even to me. Okay, now I'm going to palpate for the spleen. So this will be along the left costal margin. So I'm going to put my hand underneath for support, and I'm going to start pushing my hand here. I'm going to ask them to take a deep breath in and exhale. And I'm not feeling anything, which is good. If I did feel something that would be abnormal, that would mean that the spleen is at least 2 to 3 times larger than it should be. And that's something that we would not want. So I'm going to go back to the other side. And I'm going to palpate midline for aortic pulsation. So I'm going to be pushing down here, and I'm looking for pulsations. I'm feeling if there's any like lateral pulsations, which I'm not feeling. I'm not seeing anything. This is to assess for any an aortic aneurysm. The next thing I'm going to do is I'm going to palpate the lymph nodes, the inguinal and femoral lymph nodes. And I'm not feeling any swollen lymph nodes. Okay, now I'm going to percuss all 4 quadrants. And there should be a tympani. Now there might be some areas of dullness, but that could maybe indicate maybe there's some stool within the abdomen, but for the most part, I should be hearing tympani throughout, which I do. The next thing I'm going to do is I'm going to percuss the anterior to the left mid-axillary line, and this is going to be looking for any splenic dullness. This is known as the Traub's point. So I'm going to start. And I don't hear any dullness. So now I'm going to do the Murphy sign. So what I'm going to do is this is in the right upper quadrant, and I'm going to push deep in, and I'm going to ask the patient to take a deep breath in. As I'm pushing and exhale. Now, if this was positive, he would not be able to take a full inspiration while I did that, and this would basically assign for an inflamed gallbladder. And then next thing I'm going to do is I'm going to locate McBurney's point. Now McBurney's point, I'm going to look for the ASIS, which is the anterior superior iliac crest, which is also the hip, and the umbilicus. And I'm going to move about a 1/3 way up. And this is McBurney's point. I'm going to push in. Is there any tenderness?
None whatsoever.
And this would also assess for appendicitis. The other thing I'm going to do is I'm going to test for rebound. So that's when you push in. Any pain?
None.
Any pain when I did that?
No.
So when you let go quickly, and if there was any pain, that would be rebound pain, in which he does not have any, which is great. Now I'm also going to do the Rosing sign. So that would be where I go to the left lower quadrant. I'm going to push in. Any pain?
None.
Now if you had pain in the right side, if it had radiated, that would be a positive Rosing sign, and that would indicate appendicitis. There are 2 other signs that could indicate appendicitis. So one's called the SO sign. So what I'll have you do is I'm gonna have you lift your leg up, the right thigh. I'm gonna push against the resistance. He's gonna push against it. Are you having any pain?
None.
If he had pain in the right lower quadrant, that would be a sign of appendicitis. The other test I'm going to do is I'm going to have, it's called the obturator sign, and that's where I'm going to have him flex his hip and knee, and then I'm going to internally rotate the leg. So that would be with the foot out. Any pain or discomfort?
None.
Okay. And so that concludes for the patient, but the last part that won't be on the video would be a rectal exam. And I would get the patient's permission to do that, get consent. I would I'd wash my hands, don gloves, grab a lubricant, I would have him either lay on his left side, or I would have them stand and lean forward. I would insert my finger. I would be palpating for any lesions, masses. I would assess if there was any internal hemorrhoids. I would have him tense up to see if his sphincter was intact and working. I would assess his prostate. Upon removal, I would assess my finger if there was any blood, mucus, anything abnormal with that as well. I would end the interview and the assessment with the patient. I would take my gloves off, wash my hands, and that would be the end of the abdominal assessment.